Hello and welcome to my YouTube video. Today I'm going to talk about the cost of health insurance. Because I'm a health actuary, people often ask me, why is my health insurance so expensive? Most of us have seen our insurance rates go up and up every year, often by dramatic amounts. Today, many families see hundreds of dollars taken out of every paycheck. Those who don't buy their insurance through an employer may get coverage directly from the insurance company. Many of these families pay over $1,000 a month just for their health insurance. And yet, every year it seems we face higher and higher deductibles, and we have to pay higher co-payments for our drugs and office visits. Does it really all have to cost so much? To find out the answer, let's look at what your health insurance coverage pays for. Generally, health insurance claims can be broken down into four major categories: inpatient hospital, outpatient facility, professional and other medical expenses, and pharmacy. Now, in the following slides, I'm going to supply a bunch of numbers. Keep in mind, these are averages taken from huge populations of insured individuals under the age of 65 who get coverage through their employer. Your local market could be a good bit higher or lower than these numbers, but what I'm about to show you are a good representative sample. Let's look at the first major category of claims. Inpatient refers to situations where a patient is admitted to the hospital overnight. Patients are admitted to the hospital for any number of reasons. Some of the most common are birth of a child, surgeries that require the patient to stay in the hospital overnight, trauma such as horrible injuries, and complicated illnesses where the patient needs to be observed and treated around the clock. Outpatient facility claims include a wide range of services. Some of the most common are ER visits and radiology for things like an MRI or CAT scan, outpatient surgery, which can occur at a hospital or an ambulatory surgery center, hospital-based therapy or rehab following an injury or surgery, and pathology, which is a fancy word for medical test. Professional claims are for a lot more than just doctor's office visits, but also trips to a therapist outside a hospital, as well as chiropractors and other medical professionals. And remember those surgeries we talked about earlier? You don't just get a bill from the hospital, but also from the surgeon who performed the operation and the anesthesiologist. Then there are other medical services, such as durable medical equipment, things like wheelchairs, crutches, foot orthotics, you name it. So how much do each of these categories cost? You can find out by looking at a great free report on the website for a firm called PricewaterhouseCoopers at pwc.com. This graph shows PwC's estimates for 2010. You'll notice they have two different categories for physician cost and other medical. A lot of actuaries such as myself, we combine the physician and other medical cost into a single category called professional services. These figures from PricewaterhouseCoopers are very close to the numbers I see every day in my work as an actuary, reviewing claims data for millions of Americans who are fortunate enough to have health insurance. But what do these numbers mean in terms of real people and real situations? Let me break it down for you. Let's start with those inpatient hospital costs. And the numbers I see every day, for the under 65 group insurance market, there are roughly 60 hospital admissions for every 1,000 members in a year. That may sound like a lot of trips to the hospital, but remember, that includes all of these different categories we saw earlier: childbirth, complex surgeries, trauma, serious illness. And we haven't even mentioned the people who are discharged from the hospital only to go back a week or so later. All of these contribute to that annual number of hospital admissions. So let's say that these 60 admissions per 1,000 members cost, on average, about $13,000 to $14,000 each. Remember, these are the costs paid by your insurance company after you subtract out the deductibles and co-payments paid by the patient. Again, this average can vary a lot from one state to the next, depending on the cost of hospitals in each region and how high your deductibles are. Now, you multiply those two figures together, the 60 admissions per 1,000 members, the $13,500 per, and you get $810,000 paid by the insurance company for every 1,000 members, or $810 per member per year. Divide it by the 12 months in a year, and you get over $67 paid by your plan per member per month. Now let's take a look at outpatient facility claims. This first figure is going to blow your socks off. In a typical employer group health insurance plan, we see about 1,100 outpatient claims for every 1,000 members per year. This is a staggering figure. You might think, no way, that's more than one claim per member per year. How's that possible? Remember, we have to think about all the types of services that come from outpatient facilities. I showed you this list before. Some of these are things that happen once, and hopefully you don't have to go back for a long time, if ever. But some of these are things that you have to make a lot of trips for, like rehab visits following a knee replacement, or radiation oncology visits for cancer patients. All of these drive that average number of visits higher. So how much do these visits cost? On average, insurance companies pay about $700 each. Of course, the actual cost for any particular visit can be a lot lower or higher, but this is a pretty typical average of what your insurance company pays. Multiply the 1,100 claims by the $700 average each, and you get $770,000 paid by your plan for every 1,000 members, or $770 per member. Divided by 12 months, and you get a cost of $64 paid by the plan per member per month. Now let's move on to the professional cost. Here's another shocking figure. The average member in a typical employer group has 7 or 8 claims per year. This is another number that took me a long time to wrap my head around when I first became an actuary. I didn't think it could possibly be true, but I see the data all the time, and it is. Remember this list? A lot of people have several of these in the same year. Young kids go to the doctor's office all the time, it seems. Pregnant mothers, they have to visit their OB/GYN. Somebody recovering from knee surgery may go for several visits of therapy and rehab. Individuals with back pain may see a chiropractor every month, or even every week for several months. Like I said before, when you get a surgery done, you have bills from the surgeon, the anesthesiologist, not to mention the before and after visits with your primary care doctor. So that's how we get this average of 7 or 8 claims per year for every member. The average professional claim paid by your insurance company, usually in the range of about $150. Doctor's office visits are usually a good bit lower, but surgeons charge a whole lot more. It all averages out to around this $150 paid by the insurance company. Multiply that by, let's say, 7.5 claims per member per year, and you get $1,125 paid by your insurer per member per year. Divided by the 12 months gets you almost $94 paid for every member for every month. Last category is pharmacy. The average employee getting coverage through their employer buys 10 prescriptions per year that are submitted to their insurer. Now, if you go to Walmart or some other store for a $5 generic, the pharmacy doesn't always submit those to the insurance company since you're paying the whole thing out of your pocket. So this 10 prescriptions per year is the average number that do get submitted to your insurance company. Many patients get a prescription every month, and a significant number take more than one of these drugs on this list on a regular basis. Now, those last two, pain medicine and prenatal drugs, those are prescriptions that people get on a temporary basis, but they contribute to the overall total. For the prescriptions that are submitted to the insurer, on average, the plan pays about $55. That's after your copayment. Yes, there are a lot of cheap drugs available today, but again, many of those $4 and $5 drugs, they're not being billed to the insurer. So these 10 drugs per year that are paid by the insurance companies, they are overwhelmingly those expensive drugs. Multiply these 10 prescriptions per member per year times the $55 paid, you get $550 paid by your plan per member per year, or an average of about $45 per month. Now, let's add it all up. We already showed over $67 on average for every member every month just for the inpatient hospital claims. Another $64 for the facility outpatient claims. Add to that another $93 and change for the professional claims, and then top it off with over $45 every month for the average member to pay for their drug cost. That comes to a total of over $270 in average medical cost per member per month. Some states a little better, some are much worse. These are pretty typical numbers here. At this point, you might be saying, okay, but I know my insurance company doesn't pay that much for me and my family. But that's not how it works. Your insurance company pays for your medical bills and for everybody else who buys the same insurance from that company. Everybody's claims are thrown into the same pot, and the total is paid by everyone. That's how health insurance works. I hope that you learned something from today's video. I know a lot of these numbers surprised me when I first started working as an actuary. If you would like to hear more, please feel free to subscribe to my videos on youtube.com, or you can visit my website at fixthehealthcarebill.com or theanonymousactuary.com. Thank you for your time watching today, and remember, my videos are not intended to stop healthcare reform, but to provide information so that we can make wise decisions about what reforms we really need in order to improve our healthcare cost. Thanks again, and have a great day.